Breast Cancer and Exercise by Lauren Boyle. What is breast cancer? Breast cancer is the abnormal growth of breast cells. There could be two different categories of cancerous cells. They could be benign, which does not spread throughout the body, where malignant cancers are dangerous and do spread to other parts of the body. Malignant breast cancer cells usually start in the milk-producing glands or in the ducts. They can spread to the surrounding breast tissue and the underarm lymph nodes. Once it reaches the lymph nodes, it could spread throughout the entire lymphatic system and reach places such as the liver and spleen. In the picture below, we could see a zoomed in terminal duct, and then zoomed in even more, we could see the inner layer of the epithelial cells and the outer layer of the epithelial cells, and then we could see the cells that will produce the milk for lactation. Pathophysiology. There are environmental factors such as obesity, diet, alcohol consumption, and then there are hormonal changes such as progesterone and estrogen, and then genetics, which include gender, age, and family history. Together, they can create DNA damage and the failure to repair. After the failure to repair, they'll become mutations. The mutations can lead to the growth of promoting oncogenes, which is when the cells come together to create the tumor. And then there's also the modifications in apoptic genes, where apoptosis is cell death. So a reduced cell death will increase cancer cells to grow. The progression of the tumor will grow, and then malignant neoplasm will occur. Genetics versus the environment. 5 to 10% of breast cancer is hereditary. The BRCA1, BRCA2, and the CAGK2 genes are the most associated and the highest risk in multiple cancers, such as ovarian cancer and breast cancer. 85 to 90% of the genetics will have abnormalities from the environment. These will include age, gender, race, estrogen levels, pregnancy, breastfeeding, and radiation. These are all things that we can't control, whereas factors such as weight, diet, exercise, alcohol consumption, smoking, and stress are all behaviors that we can change to reduce our risk for breast cancer. In the graph below, we could see the percentages of each of the genes that are associated with cancer. And then first-degree females, which include mother, sister, and daughter, having breast cancer will increase the risk of the familial genes to increase by 2 times. Symptoms of breast cancer. The breast itself can dimple or have pitting, which is in the skin. It will create irregular borders, which is not smooth. Noticeable changes and lumps, we could see that's why we feel ourselves. And then the breast itself can change in color, or the nipple itself can change color. The nipple can discharge fluids, blood, or a serous fluid, which is like white and creamy. The breast will feel pain, or the nipple could have pain. Breast cancer testing. After puberty, girls should be performing a monthly breast exam. They should have the 3 fingers and feel around under the arm into the breast. A doctor should perform a yearly breast exam during checkups. After the age of 40, it is recommended to go for a mammogram. And then some insurance companies will provide MRIs or ultrasounds to detect the affected tissues. After the detection of the tumor or the lump found by the previous testing techniques, a biopsy or fine needle aspiration is performed. The biopsy is sent off to make a diagnosis. Once a diagnosis is made, it will be considered benign or malignant. The stage of the cancer is going to be determined on if it's benign or malignant. So the stage of breast cancer is also determined by how far it has spread from the original site. It also has characteristics such as the size of the tumor, the location, and if the cell contains hormone receptors. The stage of breast cancer will allow doctors to figure out a treatment and then prognosis. The stages range from 0 to 4, with 0 being non-invasive and 4 being invasive. In the diagram below, we could see the different stages and how far each has been affected. Stage 1, it's less than 2 centimeters and has not spread. Stage 2, it's less than 2 centimeters, but the lymph nodes are still less than 2 centimeters. Any size, and it has spread to the axillary lymph nodes. And then stage 4, it has spread to other organs of the body. So once the diagnosis is made, a treatment is picked out. There are different options. Surgeries include breast-conserving surgery. This is when it's usually a stage 0, so it hasn't spread yet. The breast-conserving surgery will go in and take out the affected tissues while conserving the rest of the breast. A mastectomy, on the other hand, will take out the entire breast tissue. If the nodes have been affected, an axillary lymph node dissection is also an option. There are different therapies, chemotherapy being the most popular. Chemotherapy is when we are given drugs and cytotoxins to kill within and have medications to kill the cancerous cells. Radiation therapy is when a beam of light has radiation to kill the cells. And then endocrine therapy has to deal with estrogen levels. We will be given anti-estrogens and then ovarian suppressions. Similar to ovarian cancer, the estrogen levels will impact the type of diagnosis. So given ovarian suppressions will decrease the amount of LH hormone that's being released, and then the decrease of LH hormone will decrease the amount of estrogen levels being released. Exercise and breast cancer. Exercise at any point in time before, during, or after diagnosis has been proven to be beneficial. Women in a study who were active prior to diagnosis had a higher chance of survival and a lesser chance of the cancer returning. Those who met the exercise guidelines reduced the chance of death by 68%. It is recommended for those with breast cancer to be in walking programs. Breast cancer is a very overwhelming time, so it could be very stressful. So walking can be beneficial for the mental state, and then physically could help with our cardio. Weight training has also been shown to be beneficial to help gain muscle mass back, but it's also been shown to help with lymphedema flare-ups. Lymphedema is the swelling of the arms or legs due to fluid, so contracting the muscles can help flush out fluid. My case study is Miss A.B. Miss A.B. is a 40-year-old mother of two. Miss A.B. was sedentary before her breast cancer diagnosis. She is recovering from stage 1 breast cancer. Due to the risk of her spreading, Miss A.B. had a mastectomy. Miss A.B. is not able to lift above her head or lift more than 8 pounds due to reconstructive surgery. In addition to the mastectomy, Miss A.B. has fought 4 rounds of chemotherapy. Miss A.B. has bad days where she often feels sick due to the drugs. She has a BMI of 26 and has been gaining weight since chemotherapy. Miss A.B. wants to improve her endurance since she fatigues very quickly. She also wants to slowly lose the weight she's been gaining. And finally, Miss A.B. needs to gain the strength that she has lost. Miss A.B. wants to be able to complete her activities of daily living. The exercise testing I would do would be a 6-minute walk test. Since Miss A.B. fatigues quickly, a 30-minute walk test would be too long. A 2-minute step test would be a little exhausting for her, but we'd be able to get a read on her VO2 max. And then since Miss A.B. cannot lift heavy things or perform exercises, she should be able to do a hand grip test that would be able to see the strength in her hands and arms. It's an isometric strength test, so she should be able to complete this one. My exercise prescription would be a frequency of 3 to 5 days, an intensity of light to moderate, a time of 180 to 300 minutes a week, with the type being aerobic, strength training, and flexibility. My plan is to do a walking program with an intensity of 40 to 50% since Miss A.B. fatigues frequently. We could set a goal as a mile walk. As the weeks continue, we could focus on doing longer walks to increase duration and endurance. The intensity can be increased from 60 to 60% if jogging is applicable if the fatigue decreases. She should also be doing a weight training program, beginning with 2-pound weights, doing 2 sets of 10, focusing on her arms and not lifting over her head. As the weeks continue to increase, we can increase the weight and we can increase the number of repetitions per set. Yoga and dynamic stretching should be done daily to reduce her lymphedema buildup. She should meet with a dietitian to manage her caloric intake if she wants to lose weight, but since she's also having sick days, she needs to be healthy and she should deal with a nutritionist for her sick days. In conclusion, Miss A.B. will have many modifications and precautions. The first few weeks of her following her treatment, she will not be able to lift over her head, and it could prevent the opening of her stitches. This will interrupt many of her activities of daily living. Miss A.B. will not be able to maintain high intensities or durations due to her previous sedentary lifestyle and her body fatigue. Miss A.B. may not be able to do a full 5-day frequency due to her sick days, so she may be able to only complete 2 or 3. It may take longer than a 12-week period to regain Miss A.B.'s muscular strength. Thank you.